Rabies is a deadly viral disease that affects the central nervous system of humans and animals. It has been known for thousands of years and remains a major public health problem in many parts of the world, especially in Asia and Africa. Once symptoms appear, rabies is almost always fatal, but it is completely preventable with timely medical care. The disease is mainly transmitted through the bite of an infected animal. Cause of rabies. Rabies is caused by the rabies virus, which belongs to the lyssavirus genus. The virus is present in the saliva of infected animals. When an infected animal bites or scratches a human or another animal, the virus enters the body through broken skin or mucous membranes. After entering, the virus slowly travels along the nerves to the brain, where it causes severe inflammation. Animals involved in transmission. Rabies can affect all warm-blooded animals, but dogs are the most common source of human rabies deaths worldwide. Other animals that can transmit rabies include cats, bats, monkeys, foxes, raccoons, wolves, and skunks. In many developed countries, rabies is more commonly spread by wild animals, while in developing countries, stray and unvaccinated dogs are the main carriers. Mode of transmission. The most common mode of transmission is through bites from rabid animals. However, rabies can also spread if saliva from an infected animal comes into contact with open wounds, cuts, or the eyes, nose, or mouth. Very rarely, rabies has been transmitted through organ transplantation or inhalation of virus-containing aerosols in laboratory settings. Rabies is not spread through casual contact such as touching or sharing food. Incubation period. The incubation period of rabies usually ranges from 1 to 3 months, but it can vary from a few days to several years. The length of the incubation period depends on factors such as the location of the bite, severity of the wound, amount of virus introduced, and the person's immune system. Bites closer to the brain, such as on the face or neck, often result in a shorter incubation period. Symptoms of rabies. Rabies symptoms develop in stages. Early symptoms are often mild and may include fever, headache, weakness, fatigue, and pain or tingling at the bite site. As the disease progresses, neurological symptoms appear, such as anxiety, confusion, agitation, hallucinations, difficulty swallowing, excessive salivation, and fear of water, hydrophobia. In the final stage, the patient may experience paralysis, coma, and death. Types of rabies. There are two main clinical forms of rabies. Furious rabies is the more common type and is characterized by hyperactivity, aggressive behavior, hydrophobia, and aerophobia, fear of air. Paralytic rabies is less common and causes muscle weakness, paralysis, and loss of sensation. Paralytic rabies progresses more slowly but is equally fatal if untreated. Diagnosis. Diagnosing rabies before the onset of symptoms is very difficult. Once symptoms appear, diagnosis is based on clinical signs, history of animal exposure, and laboratory tests. Tests may include examination of saliva, blood, cerebrospinal fluid, and skin biopsies. Unfortunately, there is no reliable test to detect rabies during the incubation period. Treatment. There is no effective cure for rabies once symptoms have developed. Treatment at this stage is mainly supportive, aiming to reduce pain and discomfort. However, rabies can be prevented if post-exposure prophylaxis, PEP, is given immediately after exposure. PEP includes thorough washing of the wound with soap and water, administration of rabies immunoglobulin, and a series of rabies vaccinations. Prevention and control. Rabies prevention focuses on vaccinating animals and providing timely treatment to exposed individuals. Vaccination of dogs is the most effective way to reduce human rabies cases. People at high risk, such as veterinarians and laboratory workers, should receive pre-exposure vaccination. Public awareness, responsible pet ownership, control of stray animals, and prompt medical care after animal bites are essential measures. Global impact. Rabies causes tens of thousands of deaths each year, with children being the most affected group. Most deaths occur in low and middle-income countries where access to vaccines and medical care is limited. The World Health Organization, WHO, aims to eliminate human rabies deaths caused by dog bites through global vaccination and education programs. Conclusion: rabies is a serious but preventable disease. Although it is almost always fatal once symptoms appear, timely vaccination and proper wound care can save lives. Increasing awareness, improving vaccination coverage in animals, and strengthening healthcare systems are key steps toward eliminating rabies worldwide.